Vitiligo causes symptoms. Best diet. What is vitiligo? Vitiligo affects the skin, eyes, and mucous membranes by destroying cells that produce the body's pigment. The most obvious results of this condition are white splotches in the areas where the skin isn't producing enough pigment. This is not a serious condition, but research physicians are still investigating methods for correct diagnosis, treatments, coexistent diseases, and psychological side effects. Our hair, eyes, and skin are given color by a pigment called melanin. This material is constantly being broken down and replaced, so it must be replenished by cells called melanocytes. Melanocytes manufacture and distribute the correct amount of melanin, but for people with vitiligo, this process gets disrupted. As scientists have found, this disorder destroys melanocytes for unknown reasons. They have categorized it as an autoimmune disorder because no external cause seems to be responsible for it. In autoimmune disorders, your body mistakes itself for an enemy intruder and declares war on those enemy cells. Your malfunctioning immune system continues attacking your own cells, in this case, melanocytes. The most common symptom of vitiligo is light or white patches of skin anywhere on your body. These are commonly found on areas that receive a lot of sunlight, like your face, back of the neck, forearms, hands, and feet. They can also affect other areas, such as underneath your arms and genitals. For the most part, the symptoms are the most serious aspect of this condition, and doctors direct their treatment toward this aspect. If you suspect you have this disorder, make sure to go to your physician for an official diagnosis and consultation. You can expect a physical exam of your skin from a dermatologist. At this stage in research, there are a number of different courses of treatment, ranging from light therapy to oral medication to strong sunscreen. Since this disorder seems to affect young people more than older people, physicians cite the psychological effects of the disease as a major issue. A person with a visible difference in skin coloring, called depigmentation, may be influenced to see their body as unhealthy, disabled, or unattractive. Doctors encourage young people to see a psychologist to help with this reaction. Vitiligo may point your physician to another coexisting condition often seen with depigmentation. Anemia, lupus, and hyperthyroidism are often found in people with vitiligo. Genetics are also probably responsible, since the condition seems to run in families. Unfortunately, the condition usually gets worse as time goes on. However, it is certainly not contagious. What are the symptoms of vitiligo? Vitiligo is a skin condition that affects less than 1% of people worldwide. Those suffering from vitiligo experience an absence of melanin, the pigment that gives skin its color. Generally speaking, people who have darker skin possess more melanin. Lighter-skinned individuals have a lower concentration of the pigment, and a lesion of vitiligo is virtually free of melanin. A person diagnosed with this rare disorder will most commonly experience symptoms of vitiligo pertaining to colorless skin lesions. These lesions can exist anywhere on the body, although vitiligo will most likely manifest itself around a bodily orifice and is likely to be symmetrically located on a person's body. The symptoms of vitiligo usually begin as very small patches but tend to gradually increase in size. Their shapes also have been known to be dynamic, sometimes evolving into vastly different forms than they were when they originated. In addition to the physical symptoms of vitiligo, this disease commonly carries with it a number of secondary medical and psychiatric conditions, largely because of the disfiguring nature of the disease. Depression and many anxiety disorders are among the secondary medical issues that might follow a diagnosis of vitiligo. There are primarily two types of vitiligo: non-segmental vitiligo, NSV, and segmental vitiligo, SV. Non-segmental vitiligo is the more common of the two, and although it encompasses many subtypes, this classification can be generalized as having symmetrical lesions, covering a large portion of the body and possessing no specific age of onset. Segmental vitiligo typically spreads more rapidly, occurs during teenage years and is not necessarily found in symmetrical patterning. In addition to this, SV might occur in small, localized regions, which contrasts with NSV in that NSV covers a large area of the body. Although the precise cause of vitiligo is unknown, many experts theorize that its origins are autoimmune, neural, viral or genetic in nature. Melanin is produced by cells called melanocytes. When these cells fail, become dysfunctional or destroyed, the human body's ability to maintain designated levels of melanin also suffers, causing albino skin lesions in seemingly arbitrary locations. This disease affects all races, although it is most noticeable in those who have dark skin, because of the contrasting nature of the lesions in comparison with their complexion. There is no cure for this disease, although a number of treatments do exist that intend to mask the symptoms of vitiligo. Most of these procedures aim to camouflage the lesions. This can be done in a number of ways, including the application of sunscreen to non-affected areas to keep them as pale as possible, the dyeing of affected areas or the bleaching of non-affected areas in attempts to make the skin more uniform in color. What are the causes of vitiligo? Doctors and scientists aren't completely sure what causes vitiligo. Experts do, however, have theories about its causes. For example, one theory involves genes and the idea that some people inherit a vulnerability to skin discoloration issues. Another theory is that the condition may develop because of an autoimmune problem. Some theories also point to problems with pigmentation cells and injuries or infections that stimulate the depigmentation that marks the condition. Often, scientists and doctors are able to point to a particular cause when it comes to a disease or condition. Unfortunately, however, this is not the case when it comes to certain types of skin conditions, and vitiligo is one of them. Doctors and scientists are unsure of what causes the depigmentation that is typical for a person with this skin change. Eventually, studies may reveal the exact causes, but for now, patients typically do not have an answer to why they have developed this disease. While scientists and doctors do not know the exact causes of vitiligo, they do have theories about its causes. One theory is that the condition may be caused by genes. Some studies have shown that people who have this condition often inherit a particular collection of genes that makes them more likely to develop it. Essentially, the people who inherit this group of genes seem to be particularly vulnerable to skin pigmentation issues. Some doctors and scientists theorize that a problem with a person's immune system is one of the causes of vitiligo. They believe the condition develops when a person's own immune system mistakes body tissues for foreign matter and attacks them. When a person's immune system malfunctions this way, the person is said to have an autoimmune condition. There are many types of conditions that are marked by this type of malfunctioning, however. Vitiligo is just one of many that is suspected of being related to immune system issues. Less often, scientists and doctors present the theory that trauma or injury is among the causes of vitiligo. The idea with this possible cause is that injury to the skin cells may lead to the depigmentation. For example, damage to the skin caused by a severe case of sunburn or an infection could cause the condition if this theory is correct. Others believe a defect in pigment-producing cells is at fault. Though the causes of vitiligo are unknown, the manner in which the condition progresses is clear. Cells called melanocytes, which are responsible for producing the pigment in the skin, fail to do their job. The area of the skin where the problem cells are located gradually turns white as a result. How do I choose the best vitiligo diet? Vitiligo is an autoimmune disorder which causes various areas of the body to lose pigment, creating a blotchy look to the skin. It is believed by many that a healthy vitiligo diet can help to control the disorder and promote healthy skin and cell regeneration. Some of the recommended foods on this diet include whole grains, tomatoes, spinach, fish, and soy. Some of the foods which should be limited or eliminated from the vitiligo diet include some berries, cashews, mango, and tea. Choosing the best type of diet for vitiligo on an individual basis is often a matter of trial and error and should take into consideration factors such as personal preference, existing health concerns, and food allergies or sensitivities. Whole grains are an important part of a vitiligo diet. These grains are full of vitamins, minerals, and fiber which support overall health. Oats may be particularly beneficial due to the high levels of vitamin E contained in the oats. This vitamin is known to improve the body's natural immune responses and may also help fight harmful bacteria. Certain vegetables should be incorporated into a vitiligo diet whenever possible. Spinach contains substantial amounts of various nutrients which may help to repair damaged blood vessels and promote skin regeneration. Garlic has natural antibiotic properties and contains a wide variety of nutrients which work to keep the cells healthy. Cabbage contains many nutrients and contains substances which help the body break down harmful chemicals within the body. Fruits such as blueberries and tomatoes are also known for their healing properties and are a great addition to this type of diet. Healthy fats are an essential part of a proper vitiligo diet. Olive oil is one of the best sources of this type of fat and can easily be added to most diets. Most nuts are ideal for those with vitiligo, as they contain healthy fats as well as protein. Cashews and pistachios are the chief exceptions to this rule, as they are not typically recommended for those with vitiligo. Some foods should not be added to a vitiligo diet, especially in high quantities. These foods include mango, red chili, and tea. Some berries are not recommended for those who suffer from vitiligo. These berries include blackberries, raspberries, and cherries. In addition to the various foods that are recommended parts of the diet for those with this autoimmune disorder, it is important to drink plenty of water in order to keep the skin hydrated and healthy. Some foods should not be added to a vitiligo diet, especially in high quantities. These foods include mango, red chili, and tea. Some berries are not recommended for those who suffer from vitiligo. These berries include blackberries, raspberries, and cherries. In addition to the various foods that are recommended parts of the diet for those with this autoimmune disorder, it is important to drink plenty of water in order to keep the skin hydrated and healthy.
I hope you enjoyed our review. If you would like to order this product or see further details, then simply head over to the website address you see on the screen right now.